Yeah? Something growing, something that already affects both animals and human. Antimicrobial resistance. This is not just a veterinary issue. This is not just a human medicine issue. This is a global crisis, and many people do not even realize they are contributing to it. And Marwa is one of the people who is contributing to this. Let me say this about antimicrobial resistance. It happens when bacteria or parasites or other microorganisms stop responding to drugs that meant to unalive them. In simple terms, the medicine stops working, not because the disease is stronger by nature, but because we have made it stronger through misuse. And what Marwa is doing is misusing the drug. So every time drugs are used incorrectly, every time antibiotics are given without proper diagnosis, every time treatment is started, stopped, or changed without guidance, we give microorganisms a chance to adapt, to survive, to evolve, and once they evolve, they don't go back.
Yeah, you know, these days, even me as Maro have learned how to detect, to not treat, but to, like, we can do something before the vet shows up, you know. Otherwise you'll be crying like a crybaby. Oh, I don't know what to do, where should I start from, help, and then you can't help. So it's good that at least, like now, we've learned how to inject intramuscular drugs. Those are drugs that you put in the muscles of the horse. So what you do, you put your palm like this from here till the end, right above the front of the shoulder there. Then you can...
Morning, beautiful people, beautiful individuals, ladies and gentlemen, welcome back to another reaction video. This is Maxwell Lumumba Africa. Here in Kenya, it is early in the morning. That is why we can hear some sounds from the bird. We can see the sun now wants to rise. It is now 6:30 a.m. in the morning. As always, I do reaction videos, especially to the videos that have been posted in public domain. Like today, I want to discuss about something that we call AMR, that is antimicrobial resistance, and also I'm going to discuss about Marwa on horse treatment. Marwa's now become a vet by his own, because I remember there was a time when that horse that had a leg problem before it died, I came on camera and I rebuked something when it comes to veterinary ethics. A lot of people were saying a lot of issues about that Max, let them do this, but I was really against it. Yeah, and today Marwa again has come on camera and has discussed about how to make diagnosis. He went ahead and spoke about how they do medication before a vet comes, and he goes ahead and trains people on how to do what we call intramuscular injection of drugs. Yeah, so I'm going to cover about that, and I'm going to talk about antimicrobial resistance, what is happening when it comes to globally, like Kenya. We have a challenge when it comes to AMR, yeah, antimicrobial resistant, and that is something that I'll be tackling toward the end of my conversation, because I know a lot of people want to hear what is this antimicrobial resistance. Yeah, I'll be giving us a full detail about that. And before that, I also have another YouTube channel that goes by the name Vibe with the Lumumba. The way said, I'm almost constructing my house. Like tomorrow, I'll be bringing the first track of sand, and I'll be going live to demonstrate that, either sand or or the stones. Yeah, so let us join hands, let us do things like teamwork. That is what the call of action for that I can say from my side. And let us support that YouTube channel. Already I've put a lot of videos, so that means that the channel has now kicked off. Yeah, so I'll be posting videos daily until it gets monetized. Let us watch those videos that you get there, because I started that YouTube channel when this year was beginning. So let us go and support that YouTube channel. That being that, let us subscribe, like, comment in all the YouTube channels. Let us turn on the notification bell so that any day, anytime I post any video, you people get updated. Watch my videos till the end without skipping any ads. And today's topic, let me speak slowly, let me speak clearly, and let me speak from a professional standpoint, because what I'm about to analyze is not just information, it is influence. Marwa came on camera and began discussing horse treatment. He talked about temperature, he talked about medication, he talked about giving Epsom salt as a supplement, and even went ahead and say that now he knows how to inject animals intramuscularly. So this is not just a conversation. This is someone presenting himself as a capable of handling medicine situation. And that is where we need to be very careful. I usually ask a lot of people, when you feel sick, what action do you take? Do you just go to the chemist or a pharmacy and buy drugs, or you go seek medical intervention before you take drugs? Because you know, we are now talking about living things. Yeah, living things that don't talk. They cannot tell you that I'm feeling headache. Animals don't tell you that I'm feeling backache, or they cannot tell you that I have been injured, or I have a lot of worm overload. So animals don't speak. So you coming on camera and tell us how you can detect a disease on temperature and everything, yeah? Because I have to come here categorically and discuss about that, because understanding what Marwa said about temperature.
So we can actually monitor the temperature of one of our horses. So with horses, you cannot even tell if it's sick by just looking. So the temperatures tell you anything above 38.5, I mean, you start knowing there could be something. So one of our horses did 39.40.
Marwa says that horses, you cannot easily tell when they are sick. Then he says that anything above 38.5 degrees Celsius indicates sickness. Let me just rubbish that, and let me, with this calling me, sorry for that call interference. So I was saying this way, yeah, let me break that down properly, because animal horses, yeah, a normal horse temperature ranges roughly between 37.2 and 38.3 degrees Celsius. But still, there is some other factors that you have to include. If the place is very cold, so that means the temperature can be even lower than that. Like in Nyabohanse, the temperatures can be lower than that. There are some places where there is it is hot, yeah. You get that the temperatures can vary, yeah. Even when taking measurement in an animal, especially during a hot sunny day, you get that the temperatures are so high that if you're not that much keen, you'll be messing with it. So yes, when a horse goes above 38.5, that is considered as fever. That part is correct, but here's the problem. Temperature alone does not diagnose a disease. It only tells you that something is wrong. It could be infection, it could be inflammation, and it could be stress, it could be pain. So when Marwa focuses heavily on temperature as the key indicator, that alone is a partial understanding. A proper assessment includes heart rate, respiratory rate, appetite, behavior, you have to go and look at what we call the mucous membrane. Yeah, you just look at you try to look at the mucous membrane. You open the, yeah, you know, where any place that you know we have mucous membrane, yeah, you have to go and look at that. And even you tend to hear the gut sounds. Yeah, when you just tap the gut side, you get that you'll be hearing, yeah, some sound that is coming out from that. So temperature is just only one piece of a much bigger clinical practice. Yeah, and let me talk about the case of the horse, which is a Rensky. Marwa mentioned a horse called Rensky. He says the temperature rose around 39 to 40 degrees Celsius. That is significant figure or fever. That is not mild. That is serious clinical sign. Then he says medication was given and temperature dropped to 36.7.
Then we gave her some medicine. Now yesterday she dropped to 36.7, and then today she's at 38.6, which is actually, when it's 38.6, you start knowing there is a problem. So
now let us pause right there. A drop to 36.7 is not normal recovery. That's below normal. Yeah, there are some temperatures that we call subnormal. Yeah, that suggests one of these two things: either measurement is inaccurate or intervention affected the body too strongly. When I'm saying intervention affected that, when Marwa is saying that they now know how to inject a horse intramuscularly. Previously, Marwa has come on camera and discussed something like phenyl. Yeah, phenyl. This is one of the strongest. We call, I don't know, I call it painkiller. Yeah, one of the strongest painkiller, yeah, that we have in the market. Yeah, so this tells us that, and I'm very sure 90% that there is a possibility Marwa with his team injected phenyl to this horse, and that is why you get that the temperature, because this has been happening, yeah, especially even for the people who have been practicing when it comes to veterinary medicine, even human medicine. Yeah, when you inject a painkiller, you get that the temperature drops drastically, yeah, from normal to subnormal, so that actually to correct the fever. But in this case, when you see that now a farmer, yeah, you know, I have now to call Marwa as a farmer, because Marwa is not even a veterinarian. He has not been licensed when it comes to veterinary. So when a farmer uses some strong drugs, like let's say these phenyl, yeah, when you use a drug like phenyl, it will affect the body too strongly. So when I came on camera, then I was rubbishing that, why do you train Marwa about drugs? One thing, that a mistake that that vet did, yeah, first, he's handing his career to Marwa. So Marwa will no longer need him that, come and treat my horse. So that means that when you train a farmer how to use drugs, be guaranteed 100% sure that you won't be called again to treat those animals, because now the farmer will say, now I know how to inject these animals, let me take it as my personal responsibility. Let me inject this horse, because even for me, I can be a doctor by myself, I can be treating my animals, and that is what we can see what Marwa is doing. So let me say this, because a healthy horse should not drop temperature the way we have been told. Yeah, so this tells us that that is below its normal physiological range. Then he says the temperature is now 38.6, and he concludes that there is still a problem. That part is correct, but the interpretation is incomplete because fluctuating temperatures tells us underlying condition is not resolved. It does not tell us that the condition is, and that is the danger. So injecting that drug, you will get a drastic change. Actually, you get a drastic change of temperature from fever to subnormal. Then you will now see that it now goes and pause somewhere, but still the underlying condition is still there. And this is now where Marwa is now talking like before even the vet comes, I'll have done these, and I'll be playing those clips, attaching them bit by bit, so that you don't say that I just came with some words, I put words in my mouth, then discuss about. So let me say this: treating numbers instead of treating diagnosis is very wrong. Yeah, making proper diagnosis is something that is very good, and that is why I said at the end of this video I'm going to discuss about AMR, antimicrobial resistance. Let me talk about the use of Epsom salt, because even for this, Marwa came on camera and said that, and Marwa said that he's going to give the horses nutrients, including Epsom salt in water.
Let's see, let's give her time today. I think she grazes like this. The good thing is I see there is enough grass here for one day. Then tomorrow they will go to the other big field. And also today we will put for them some nutrients in their water, you know, Epsom salts, things like that. And I need to ask Felix to be adding some of that in her meal, so those salts can help her fight whatever she's fighting. Yeah.
Let's explain these properly. Epsom salt is magnesium sulfate. It has several veterinary medicine use. It has even in human. I've seen a lot of people, especially for those who have elephant legs or people who have edematous leg, yeah, the swollen legs that you get that there is a problem when it comes to the drainage system, yeah, the lymphatic system. When it is affected, you get that people use it so much. Yeah? So when it comes to this magnesium sulfate, it can be used as a laxative. I remember I came on camera and discussed about that Epsom salt can be used as a laxative, and it can also help with certain digestive issues, especially when you get your animal is removing some hard poop. Yeah, you can give it there, you can give it because it will be helping. And sometimes it's used in muscle relaxation, and it can be used in extremely or external for swelling. There is where I've seen a lot of people using it. But here's the key point: it is not a general nutrient supplement. It is not something you randomly add to water and make horses drink that water without proper indication, because magnesium sulfate affects liquid or fluid balance in the body. It can draw water into the intestine, and it can cause serious diarrhea. You know, there are some things that we call like tenesmus. When you feel like okay, have you ever gone to the toilet, then you feel like you want to poop but it is not coming out? Yeah, that is what we call the tenesmus. Yeah, you feel like doing something, but when you go to do that something, it is not getting out. Yeah, so it can lead to some serious condition, and it can lead to dehydration if misused. So Marwa's horses are at risk, and if sick horse dehydrate, can make the situation worse. So the question is not what is Epsom salt, but the real question is, why is it being used in this specific case? If the horse has fever, Epsom salt do not treat the cause of the fever. They do not kill infection, the way Marwa is saying that it will be helping it to fight diseases in the body. So unless there is a very specific indication, so this approach is questionable. And I know I don't know, it's called who, Big Mark from South Africa. You will be watching my video, because what is happening is not correct thing. Why do you not engage veterinarians? That is the biggest question that I can ask. And he made a statement that I can do something before the vet arrives.
Now, these days, even me as Marwa have learned how to detect, to not treat, but to, like, we can do something before the vet shows up, you know.
Marwa says that nowadays he's a vet, he knows how to detect problems and do something before the vets arrive. Now let me get balanced here. Early observation is good, basic first aid knowledge is good, monitoring animal is good, but there is a line, a very important line between observation and intervention. Your work, you're supposed to observe. When it comes to intervention, leave the veterinarians, leave the medics to handle that. Recognizing a problem is not the same as treating it, because incorrect early treatment can lead to mask symptoms, delay proper diagnosis. Let's say, for example, now, this horse was sick. The temperature was 39, the way it was said. Then Marwa goes ahead and injects the painkiller. The temperature goes down. So when a veterinarian will be coming now to take the proper diagnosis, you'll get that the symptoms will be masked. So when we are talking about high temperatures, now the veterinarians now will say that there is no anything like high temperatures. When he goes and say that making even a proper diagnosis, you get that it will be delayed and worsen the condition. And sometimes, like this situation, where you inject just painkillers, it creates complications. So confidence without full knowledge becomes very risky. And this is what Marwa himself is doing. He's having overconfidence without having knowledge on how to handle this situation, especially in large animals like horses. I came on camera severally. I asked Marwa, why horses? Why not maybe dairy? Because already you told us you are milking animals. Do you milk horses? This is a money wasting business model that you came up with. Even when you went to somewhere, I don't remember where it was, where you met that lady who was keeping horses and told you that horse keeping is not profitable. And I remember you had to pull down that video, but you told us that the lady told you that horse business is not a profitable venture. And let me tell you about another statement that Marwa said about intramuscular injection demonstration. And this is where things become very serious. Marwa says that
otherwise you'll be crying like a crybaby. Oh, I don't know what to do. Where should I start from? Help. And then you can't help. So it's good that at least, like now, we've learned how to inject intramuscular drugs. Those are drugs that you put in the muscles of the horse. So what you do, you put your palm like this from here till the end, right above the front of the shoulder there.
He knows how to give intramuscular injection and he demonstrates it. Let me explain something very clear. Injecting a horse is not just about putting a needle into the muscle. There are other what we call critical factors. Correct anatomical location plays a good role. You have to know, even for those people who are doing medicine, you have to go and be told the anatomy of an animal, the physiology of an animal, and Even they go ahead and tell you the what we call these, the tissues. What is these? Yeah, anatomy, physiology, and there is something more. I forgot about that. So you must learn that. You have to learn where to put these needles. So needle size and angle, because when we are talking about what we are talking about drugs, yeah, we have different drugs, because some of the drugs, when you look at I don't know, not texture, when you look at not even strength, yeah, where you when you try to aspirate a drug, yeah, there is something that you look, not viscosity, yeah, the viscosity of the drug, yeah. You get that there are some drugs that look watery, there are some of the drugs that look somehow heavy, like oily. So different drugs, you can aspirate them using different ways, and it depends also on where you are going to inject, yeah. Some drugs you put them actually directly into the muscles. Some drugs you put them under the skin. Some drugs you put them in between the skin, yeah, we call them intradermal, yeah, in the skin. Some drugs we put them IV. So it depends. So, and the size and angle, because when you're talking about intramuscular, because somebody can come with a needle, yeah, you inject this way, some of them do it this way, some of them do it this way. So you have to be having an experience when it comes to that, and the depth of injection, because after the muscles we get something that therein you can get even a nerve, you can get there a bone. So you must be knowing the depth of injection and sterility, yeah, because you have to make sure that the drug or the syringe that you are using is very much sterile, yeah, and drug type and dosage. Have not seen anywhere you people measuring the horses, yeah, the weight of the horse, because drugs given to animals, you must be sure about the weight of the animal, so that you don't do excess or underdose of drugs. That is what we call, okay, I'll be talking about that when it comes to AMR. I'll be going deep into it. And risk of hitting blood vessel, you know, there's some drugs, once you put them in the blood, if they hit blood vessel, you get that even the animal will be paralyzed, huh? I've seen that happening a lot of times, yeah. And there is also a risk of nerve damage that we have to talk about, and incorrect injection can lead to abscess formation, where you go, you get that where you injected there is something that is swollen, and when you try to lavage, you get that there is something like a mass, a whitish mass coming there. Sometimes it can lead to serious or severe infection, muscle damage, paralysis if the nerve is hit, and even death in extreme cases. I've seen that. So this is not a casual skill. So somebody going to school, taking 5 years learning veterinary medicine, then somebody else in form of a quack, because I can call Marwa a quack, yeah, you want to, because the horses are yours, so you are taking the responsibility to inject them by yourself. So this is a trained procedure. Not everybody can do. You just not wake up one morning and say that I can do this and it happened, and demonstrating it publicly without full context can mislead others into thinking it is very simple. It is not. It is not simple to inject an animal. So the bigger issue is knowledge versus confidence. And let me step back. What we are seeing is not just information, we are seeing confidence, overconfidence. Marwa is speaking with certainty. He is explaining, he is demonstrating, but confidence is not the same as competency. And animals do not respond to confidence, they respond to correct care. Let me talk about risk of misinformation. When this kind of content is shared publicly, it creates a ripple effect. What Marwa did, is very wrong, and people will be copying it. People watching may think, I can do this too. I don't need a vet immediately. I can treat my animal at home, and that is where the problem begins. But partially, knowledge spreads faster than a complete understanding. People are asking, what should be done instead? Let me be very constructive. If a horse has a fever, monitor vital signs, isolate the animal, ensure hydration first, reduce stress, call a veterinarian early enough. If treatment is started, it should be based on diagnosis, not guesswork. If injections are required, they should be done by trained personnel or under guidance, because prevention of mistake is more important than correction after damage. And let me say this, because I have to talk about AMR. That is why I was doing this video. So let me end this clearly. Marwa is trying to show involvement, is trying to show learning, but animal health is not an area where partial knowledge is enough. A horse cannot explain pain. A horse cannot correct your mistake. A horse simply suffers silently. So even the decision matters. Every action matters, and every piece of information shared public carries responsibility. Because when animals are involved, mistakes are not just mistakes, they become consequences. And let me say this when I'm talking about microbial resistance, because this is the biggest challenge, not only in Kenya, globally. And before we talk about Marwa, before we talk about the horse, we need to talk something bigger than all these. Yeah, something growing, something that already affects both animals and human: antimicrobial resistance. This is not just a veterinary issue. This is not just a human medicine issue. This is a global crisis, and many people do not even realize they are contributing to it. And Marwa is one of the people who is contributing to this. Let me say this about antimicrobial resistance. It happens when bacteria or parasites or other microorganisms stop responding to drugs that meant to unalive them. In simple terms, the medicine stops working, not because the disease is stronger by nature, but because we have made it stronger through misuse. And what Marwa is doing is misusing the drug. So every time drugs are used incorrectly, every time antibiotics are given without proper diagnosis, every time treatment is started, stopped, or changed without guidance, we give microorganisms a chance to adapt, to survive, to evolve, and once they evolve, they don't go back. We have had people talking about this drug, I was injected this drug, but it is not working in my body. You have to change. Or doctors are saying that I gave injection to this patient, but he's not recovering. So that is what we call antimicrobial resistance. Now, let me bring these closer to animals. In livestock and companion animals, misuse of drugs is very common. Treating without diagnosis, using wrong dosages, mixing treatments without understanding, using drugs as trial and error. And that is what Marwa is trying to do. You just inject and wait, and you want God to control that. And all these practices accelerate to resistance. And here is the dangerous part. These does not stay in animals, they crosses into human through food, through environment, through direct contact, and this is what we call one health concept: human health, animal health, environmental health, and these all are connected. And so when resistance develop in an animal, it eventually affects human medicine. It means infections become harder to treat. It means simple diseases become life-threatening. It means surgeries become risky. It means mortality rates increases. And in the future, if this continues, we are heading towards a time where common antibiotic will no longer work, and a time where a simple infection can become fatal, and a time where medicine goes backward instead of forward. This is why every action matters a lot. So every treatment decision matters, every injection matters, every drug used without proper guidance adds to these problems. So when we watch content, we see people treating animals casually. So when we see medication being used without full understanding, we are not just watching a moment. We are watching part of global problem. And that is why today's decision is very important, because this is not just about one person. This is not just about one horse. This is about responsibility, knowledge, and the future of both animals and human health. Now, let us come back to Marwa and carefully we see what he's doing, and then we will understand what he's doing. And that is not good, because I was trying to rebuke that and I saw, oh, this, that is not something good that is really doing. That is what, when somebody else will become, let's say for example Maxwell Lumumba goes to treat that horse, you'll get that there will be a lot of resistance when, let's say, you go use drug A, but that drug is not functioning. It because of microbial resistance. Then you start saying that Maxwell came and treated my horse, or treated this and it never recovered, so I really suspect that person is not a good vet. Yeah, because you yourself, you have created what we call AMR. You go to the hospital, doctors try their best. At the end of the day, you die. That tells us that AMR plays a fundamental role when it comes to all these. So let us don't do things because we want to save money. Let us use the correct people to do it. Let us not use strong drugs. Yeah, let us not actually use strong drugs when we are doing things. Yeah, let us not do that, because it will be affecting us in the near future. Let us consult further. Let us not build enmity. Let us be guidance of ourselves and to the others. Having said that, I'll be ending this video from this point, because I have to engage in some 2-3 things. Then I call it a day. Yeah, be blessed, people, because today is on Friday. Friday ni sherehe. Yeah, Friday we have to go for sherehe. So having said that, take a moment, breathe in, then we make proper decision. Goodbye for now, till we meet in the next time. Goodbye.